Hello, my name is Aaron Jessup. I am a master's student in athletic training at Ball State University, where today we'll be discussing the injury assessment using the disablement model. For this model specifically, we're looking at a male patient with a torn meniscus in his right knee. The meniscus is the cartilage that provides a nice cushion within the knee joint between your femur and your tibia. Within each knee, there's actually two menisci, a lateral and a medial. Torn meniscus can be caused by a direct contact or pressure from a forced twist or rotation within that knee joint. So like a sudden pivot or a turn. These can also be caused by deep squatting or heavy lifting when using your knees. Some signs and symptoms that come along with the torn meniscus is going to be that pain, swelling within the knee joint, lack of range of motion where we aren't going to be able to get that full extension or flexion. Patients may also be feeling locking, catching, the feeling of instability or a slipping and popping sensation within that knee joint. Like I said, for this patient, he is a male, 35 years old. Within work where the injury first happened, as a police officer, he is also a husband and father of two children. Outside of that busy life of these three aspects, he is also a third-degree black belt in Brazilian Jiu-Jitsu, which is a big passion of his. This patient has a history of a torn ACL in his left knee, but other than that has no other history of injury. Due to this injury, we're going to make sure that we are limiting this patient from any type of running, squatting, heavy lifting, hard pivoting, or direct impact or excessive force to the joint. So with that, he is on light duty. We are restricting him from participating in his boys' t-ball practices or any type of activity with them that creates a strenuous force within the knee. So for this participation of the patient, we're going to make sure he's on light duty, like I said, until after he has a full recovery from surgery. The patient, up until then, is doing prehabilitation therapy to try and strengthen the muscles and gauge as much range of motion before surgery. Allowing the muscles to be at maximum strength and maximum range of motion pre-surgery will allow for the best results post-surgery. Like I said as well, we want to make sure that we are having him limit his activity that is strenuous on meniscus outside of daily living tasks. So other than what he basically needs to do from moment to moment, we're trying to limit that until after surgery, until after he's fully recovered. The environmental factors that come into play with him is that this patient wants to get back to full duty at work. He wants to be able to get back out in the field with his other men. He also wants to get back to playing t-ball with his boys at practices and as their coach. And then, like I said, with that burning passion for Brazilian Jiu-Jitsu that he has, he wants to be able to get back to that so that he can build up to the next belt that he's been working so hard for. With this patient, we're going to make sure we're treating him with surgery, like I said. Unfortunately, he is currently on a wait until that, so I believe he has another month or so until that surgery occurs. So until that surgery, like I said, we're going to prehab him to maintain the injury and the pain, and then allow for best results in rehab post-surgery. After surgery, the patient will be able to walk without crutches within 4 to 6 weeks, depending on the healing. But we're going to get him back into rehab to make sure we get that strength back and range of motion. However, with the range of motion, we don't want to rush it. Just because for the first couple of weeks we want to try to limit how much we're moving that joint, limiting the friction on that meniscus to allow the best healing before we start getting that joint moving again. With all of this, and as long as he sticks to his rehab afterwards and the doctor's orders, we should have him back to full duty, not only as a police officer but also as a father and a husband within 3 to 6 months. With the patient, we want to make sure that we're informing him of this risk of surgery, just because there is a risk with every type of surgery that we put a patient under. But we also want to make sure that he is aware of how to prevent future tears or how to further injure his knee until the surgery occurs. So with that, we want to make sure he's having a balanced workout allowing the best strength and flexibility, because the two working together creates the best environment for that joint to work, not only just in the knee but in all joints. We'll make sure he's limiting the pivoting on his knee with excessive force and allow his body to rest. The risk factors that come along with the torn meniscus are going to be things like age, gender. So for the age, a lot of people with a torn meniscus occur after the age of 60, except for those patients that are highly active within sports. But those patients over the age of 60 are at a higher risk. Work-related kneeling or squatting is also a big risk factor. So this also plays a big role with him being a father and also being a cop. We also want to make sure that they are aware of the risk factors of participating in activities involving quick movements like kicking, cutting, and coming to a quick stop. So in conclusion for this disablement model shows and allows clinicians to take clinical outcomes that benefit the patient's overall quality of life, not only within what they were doing when at the time of injury, but everything else that comes into a role after or outside of that realm of their life. With these models, we're also able to help other healthcare professionals have a baseline for their treatment with the same patient as you, so you guys are working as a team to make sure that they're getting back to the correct end goal, as not only as a patient or athlete or a cop in this position, but also just a person and human in general. So this is my disablement model over a patient with a torn meniscus. Thank you very much.